Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about treatment. Treatment in Iranian traditional medicine is mainly done by three ways. First and most important way is management of 6 essentials. You learn it from previous sections. Second way is using medications. There are two main group of medications, those which are used inside of the body and those which are used outside of the body. Internal or inside medications can cause changing in temperament. Sometimes they cause expelling of extra materials or wastes. Sometimes they cause retention. External or outside medications can cause changing in temperament, local or total, based on ways of using them. Sometimes they cause obstruction of skin pores, so they can cause changing in temperament as a mechanism by retention of the heat, or they cause retention of materials in the body. For example, retention of spirits, and they can cause strange for the patient. Sometimes they cause dissolving. For example, sometimes they cause sweating. Sometimes they cause dissolve of tissue. Sometimes they cause dissolve on inflammation. And sometimes they cause growth of tissues, like the medication which are used in treatment of wounds. Before you decide plan of treatment, you should notice and consider several factors. First of them is determining kind of disease. Which kind of disease you have? Is there any changing in temperament or distemperament? Is there any involvement of composition of organ? Is there any involvement of integrity of the organ? For example, in fracture or rupture, we have this integrity. And is there any complex disease from this previous kind of disease? Is there any complex disease? If the answer is yes, you should determine the organs that are involved. Is the disease obedient or disobedient? You remember what is obedient or disobedient from previous section. I repeat an example for disobedient disease. For example, consider you have warm distemperament in the liver and cold distemperament in the stomach. If you use cold temperamental food or drug for treatment of the liver, you will damage the stomach. This is a disobedient disease. So maybe you decide to use topical or external medications to correct the distemperament of the liver and use inside medication to correct the distemperament of the stomach. Another important factor is determining the cause of disease. Is the cause external or internal? Is the cause spiritual or corporal? does the cause still exist, or we have just its effect? What is formal cause? What is material cause? What is efficient cause? What is final cause? Before treatment, you should consider these causes. Another important factor is determining if your patient is strong or weak. Sometimes in weak patients, we cannot use expelling drugs or potent drug. We should have patience and try to resuscitate the energy of the patient by tonic drugs, by tonic medication, before we use expelling drug. Another important factor is to determine new temperament, if there is any changing in temperament, and to determine how much is the distance between new temperament and intrinsic temperament. If we have a large distance, for example, if we have opposite this temperament to the intrinsic temperament, the new temperament has gone far. So for bringing it back, we should have patience. We should take time to correct the new temperament and bringing it back. Sometimes we should use potent drugs with a higher degree to correct the distemperament. Another factor is age. In old age and very young age, we barely can use potent drugs, especially in very young age, for example in children and in infants. If we want to use higher degree medication, for example second or third degree medication, we should use them in short period of time, and mix them with other medication to have a compound with balanced temperament. Because if we use a temperamental drug for a long period of time, we have change in the phase and fractals of the organs, which will be remain for a lifetime.